Good morning, everyone, and thank you for joining us on Conversations in Care on the Third Planet Network. This morning, we are going to be talking about music therapy, and I have one of my favorite music therapists on the show with me today. His name is Max Lerman, and he happens to be a board-certified music therapist with Peace Hospice in the Illinois area. So I'm going to welcome Max. Max, welcome to the show.
Hi, welcome. Thanks for having me.
You're welcome. So, Max, why don't you tell us a little bit about your background?
Okay. Well, with respect to my background, I have always had an affinity towards music. I have been playing guitar professionally and recreationally since I was about 6 or 7 years old. Of course, my pursuits into playing in bands and playing with other people, of course, happened later on in life. But I started playing guitar as a hobby, and I picked it up, and I just had this immense passion for just really pursuing different types of music and learning how to play on the guitar and learning different chords, scales, arpeggios, and different patterns. And I just became enamored with it, and that's when I really started to study it seriously with respect to pedagogy. I started getting lessons. I played in jazz band throughout high school, and then, of course, I was trying to figure out when I was at the University of Iowa which avenue I would kind of pursue with music. What direction did I want to go to? What would my focus be? And I thought at first I wanted to pair myself up as a speech therapist because music and language, I thought those were really complementary to each other. It turned out academically it wasn't really comfort for me. And I heard about music therapy. I heard about the program, and it just seemed to fit. It offered all the courses that you need in terms of your basic foundations towards becoming a music therapist. Like psychology and anatomy, and there was movement for performers, which was a class that dealt with like kinesthetically, how does movement affect the body and the mind, and also my different practicum in different populations, which I was really excited to work with, such as mental health populations with depression, schizophrenia, older adults with Alzheimer's, and also young adults and children and adolescents with developmental disabilities such as autism, Asperger's disease, or cerebral palsy. So it was just a really well-rounded background in different populations. And then, of course, if people aren't familiar with the requirements towards becoming a music therapist after you get your bachelor's in music therapy, I had an equivalency from the University of Iowa. That was my degree, or my title. Once I graduated, you have to get an internship of approximately 1,200 clinical hours with a board-certified music therapist who is a supervisor who oversees you in competencies which are regulated by the American Music Association, such as playing of your instrument, documentation, maybe even doing in-services, clinically, how you're dealing with your counseling skills with those patients. Different various variables that you have to consider as a music therapist, and really being well-grounded in those skills. Mm-hmm. And so once I completed all those competencies, or when my supervisor felt I was competent enough to take the board certification exam, I took it, and then your credential is good for a 5-year period, and you have to get approximately 100 CEUs within a 5-year period. So they could be online seminars, courses, conferences, workshops, various different settings or environments you could acquire those educationally. But it was really a rewarding experience, doing my internship and transitioning towards becoming a board-certified music therapist. It was such a wonderful place to have an internship. It was at the Lerman Center for Health and Rehabilitation, which is a skilled nursing facility, but also they have a long-term care floor. They have an independent living floor. Primarily, the demographics of the population were primarily Jewish. So, culturally, there were those considerations to reflect upon when you were developing sessions. But I was with a variety of different populations, from individuals with Parkinson's to COPD, individuals who had cardiovascular accidents, Alzheimer's, dementia, so just a variety of different populations. So that's what really made it rewarding. So.
Now, Max, I don't know how many people really know what music therapy actually is, and I was hoping that you might be able to share with us a little bit what that is because one of the big things that I really wanted to have you on the show for was to really demonstrate what you do as a music therapist. So give us a little bit of an idea of what music therapy is, and then you get to play for us. How's that?
Yeah, that's fine. So in terms of a definition for what music therapy is a clinical and evidence-based application of music interventions to work on non-music goals. And all these goals are individualized to the patient's needs, their skills, their ability, their history. So you really have to be reflective of the entire person, physically, cognitively, and emotionally, as to how music is processed for them. And so with respect to some of the goals that you may work on with the various patients, maybe improvement of well-being, provide opportunities for self-expression or socialization, helping families with bereavement as their loved one may have passed away, or in dealing with strengthening their coping skills as their loved one passed away. How do they build that strength and resiliency to deal with the grief? Why are they experiencing grief? Or just working increased education or sensory stimulation. So there's so many different types of goals that you could be working on with them. But overall, it has to be individualized to their care plan. And that is what goes on with respect to the goals and objectives that you write for that patient when developing a music therapy treatment plan. So,
so Max, I worked with Max when we worked at a memory care community, and one of the things that I found interesting was just watching you and how even just the smallest things, such as helping a resident get from their room to where we were going to do activities, it was a musical experience. It was music therapy at its finest to me to watch you have those interactions. So I was really hoping that you might be able to share with us some of the things that you do to really help people, whether they have dementia, whether it's someone in a hospice setting, or whether it's, like we talked beforehand, maybe it's someone that has a, like you said, depression, schizophrenia. Show us what it looks like a typical music therapy session might look like.
Okay, absolutely. So, like you were mentioning, Tammy, it's varied across settings and populations. The type of assessment process that you undergo with a particular population, whether it's individuals with developmental disabilities, Alzheimer's, dementia, schizophrenia, or various other mental illnesses. In this context of our discussion today, I'm going to talk about it in referencing my work that I've done in hospice and when working with dementia patients. But, it always begins with the assessment process. It always begins at looking at the patient. Now, with hospice, it's a very transient, ongoing process. Our assessment kind of works on a continuum in terms of the formality of our assessment. I mean, now we have documentation, breaking down different categories, areas of functioning that we need to be looking for with that patient. But, really, from the onset, when I'm with a patient, I'm evaluating them as I enter into the room. What's their mood? What's the vibe of the room? What's the dynamics? What's going on with the family members? And that requires the music therapist to become centered and clear within their mind. They have to have empathy, openness, and compassion in looking at all these variables. What's the mood of the room? What's the position of the patient? Are they in pain? Where is the pain coming from? Is the nurse in there? Who are the other family members? And this is kind of what I like to call a sensory survey, looking at what's going on with the patient. I mean, and this can also be applicable to when you're working with children, young adults with developmental disabilities, or individuals with mental illness. You got to get a sense of the room and what's going on, because that helps you paint an overall picture of the person. Right. And then, of course, now what I'm about to say next may happen before or after the session, but it's also about acquiring their personal history. whether it's, their musical preferences, cultural and spiritual beliefs, their occupation. You want to get to know this entire person on an interpersonal level, because that is how the music is going to intrinsically affect them. And, it's really about figuring out, why that patient is connecting to the music. Is it for cognitive purposes, with respect to, memory recall or sensory stimulation or alleviating negative stimuli? Or is it for enhancement of spirituality or faith? Is it for improving socialization? You kind of can get a sense as to what the goals are when you're actually with the person for the first time. And so that's kind of how you have to create that bridge with the session. It kind of all exists on a continuum. And, really kind of, the start of the session, I mean, you could do a greeting song, maybe in the context of, maybe I'm just going to do with children, for example, be like, start off a song, be like, hello, Bobby. Hello, Bobby. Hello, Bobby. How are you today? That could be in the context of, working with a child, or, from, 3 to 5 years old, for example, trying to, build an acquaintance, build a greeting,
Right.
kind of break the ground in terms of socializing that individual with others.
Well, Max, and I almost see that
Yeah.
with seniors as well. I mean, just that small little song is, just a great way to start that relationship, start the conversation, start wherever you need to go with someone.
Right, exactly. I mean, it's really kind of creating this idea of building unity, building socialization, building relationships, connecting, building a rapport with the patient, and even with older adults, with dementia, or even my terminally ill patients. You could go on and, make it more appropriate and mature, for their age and where they are, where you could, for example, maybe go on in this context, maybe in this type of song, like, hello, Josephina, oh, hello, Josephina, hello. Thank you for having me today. And that's, the tonality and appropriateness is applicable to, where they are, in terms of their age. That's more a context of that might be more appropriate for them versus, what I would do for a child. Do you notice the difference there, in terms of where they are in terms of their maturity?
And it almost seems like it's applicable to setting too, or what's happening with that person. So, it to me that seems like a great way, especially since you work in hospice, that's a great way to start an introduction with someone that you're working with in that context.
Right, exactly. And I guess, to continue on the session, once you have that greeting song, there's various different interventions that you can move forward with based upon give and take with that individual, the dynamics, physiologically, how they may be responding to you. But a common intervention that I use a lot is reminiscence or life review. Now there's a big difference. Reminiscence, you're pulling particular memories that you're trying to elicit with that patient to associate with a specific, life event. And, with a life review, you're compiling those memories to stimulate a discussion of, their life story. So, with the life review, you're painting an overall, picture, for that patient that could be created for, a song legacy project that you could put together on a CD or in a photo. Reminiscence kind of, in the spot moments that you're kind of working on with that individual, musical pieces that trigger an experience or a memory. So, for example, the common song I use with a lot of my older adults in dementia is a song called "Meet Me in St. Louis." So, all right, meet me in St. Louis, Louis. Meet me at the fair. Don't tell me the lights are shining any place but there. We will dance the hoochie coochie. I will be your tootsie wootsy. Meet me in St. Louis, Louis. Meet me at the fair. Okay, so then once you do that song, immediately that opens up an opportunity for discussion to pick out specific memories with respect to what that topic of the song is. And of course, you want to figure out the background of that individual and the patient. But for example, it could be, did you take any trips to the fair? Was there a fair by where you lived? What were some of your favorite foods that you enjoy eating at the fair? Who did you go to the fair with? That's more reminiscing. That's more memory recall.
Right.
Now, you do a bunch of different reminiscing pieces, then that could be a compilation of a life review or, an autobiography, that creates certain milestones or events. And so that can then be a memento for that family member, when they pass away. And that's something that can be meaningful for them emotionally. It can act as, a memento that they can take with them to remember their loved one, to help them with grief, to help them with coping, as their loved one has transitioned, So.
Right.
Mm-hmm.
So when it comes to life review, how do you work, how are you, I understand how you're using the music in regards to reminiscing, but how are you using music to really kind of pull them into that life review and looking at everything that they've done in their life? So how does that work?
Well, it's really trying to connect the dots and elicit as many memories as possible to try to allow them to really tap into their long-term memory. It's trigger at certain points. It's certain phrases or sayings within the lyrics to kind of really bring them out of where they are within their disease process, to allow them to be in the here and the now with respect to reliving what was maybe going on at that fair or at that bar mitzvah or at that trip or at that wedding. So it's really kind of taking the lyrics and kind of using those as a guiding points to kind of bring back those memories, and with dementia, the long-term memory is still the one part neurologically that does not have any deficits with respect to what's going on neurologically with that individual. So it's really taking the words within the song and kind of using that as your focal point for guiding the discussion. So.
Max, and I don't know if this is something that you were planning on talking about, but one of the things that I remember that you did really well when we worked in the memory care community was working with residents and helping them to get to an activity or to get down to a room. And I would see you often kind of you'd be with them, but you might, start doing a beat or something of that nature to kind of get them moving along. Do you want to talk a little bit about that?
Yeah, absolutely. And that kind of touches on the idea of entrainment with respect to helping those individuals with dementia and Alzheimer's feel like they can have structure to help them, physically, go to a particular area or an environment or a setting, help them create that sense of relaxation and mood. And so, the concept, really is focusing on that individual or that client in the moment and kind of resonate, figure out what their mood is, what's going on with their temperament or their disposition in the moment, and trying to match what I'm doing musically to physiologically or psychologically certain parameters that are going on with that patient. So just for example, let me see here. I can try to provide a context of what that be.
Okay.
Like, welcome to music today. Hello, Bob. Come on in today. Welcome, Bob, welcome to music today. And so you may be matching what's going on with their movement or maybe their hesitancy or just maybe if they're anxious or scared or worried or unhappy in that moment, and try to figure out what their mood is and trying to match where they are in the movement so that there can be a corresponding change with that patient so that they can feel more welcoming and feel more open. Because I think a lot of times we think about music and it's such a non-invasive, comforting modality, in terms of providing security and comfort. People don't see it as invasive. Now, of course, you have to figure out various variables emotionally, physically, and cognitively of that patient. Music could trigger particular associations that may be harmful for that patient and their safety. So you always have to think about what music you're choosing, why you're using that music. But if you can adapt the music to their personality, to their background, to that upbringing, that's why I talked about in the beginning, knowing that person and their history, then you can adapt it to what is going on with that person in the moment and welcoming them in. But you always have to figure out, will this music be effective? Why is it effective? And will it be harmful? Okay, then I need to avoid those particular music selections, or particular musical styles, or going a particular direction musically, because that could be harmful to that person. But if it's safe and comfortable, and if it's reflective of that person's identity and their personality, then that's an effective way to really bring people in. And with respect to entrainment, and the ISO, I call it the ISO principle, matching particular elements of the music to where they are physiologically. In my internship, I use this a lot with Parkinson's patients, and patients with strokes, to try to match particular tempo or rate or level dynamic or a particular rhythm patient was moving to help with symmetry, to help with placement of feet. For example, with patients with Parkinson's, they have that bradykinesia, or that freezing gait of their feet. And so it was really effective trying to figure out what is a preferred music. For example, there was a patient I worked on with my internship. He was in the military and the Army, and so I was immediately thinking of just some, patriotic songs that I could work on with that patient. And so I happened to use, God Bless America, to a marching beat, try to get him to move in rhythm to what I was playing. So, God bless America, land that I love. Stand beside her and guide her through the night with the light from above. From the mountains to the prairies, to the ocean, white with foam. God bless America, oh home, sweet home. God bless America, my home, sweet home. So, and then if you noticed, I was kind of doing certain subtleties in the tempo and kind of changing, and that's trying to match their mood, their rate of movement, physiologically, how they're adjusting their feet, how they're adjusting their arms, how they're adjusting their head, their posture when they're moving, in the context of that example with that, Parkinson's or stroke patient. So that's just one application of, entrainment, kind of going on that route. So.
Max, we have about 5 more minutes left, so I'm going to leave this up to you. You can either answer this question, which is, where do you see music therapy kind of moving and growing in the future? Or if you have one more modality or something else that you'd like to show us with when it comes to music therapy, it's your choice to share with us for the last 5 minutes.
Okay. Well, actually, I'm going to try to do both, if that's okay. So I'm going to talk a little bit with respect to hospice, dealing with the goal of transitioning during grief and dying when a patient is, undergoing that moment where they may be declining and they're imminent, and what goes on maybe in a session with the family dynamics and how it, it affects the caregivers a lot. I think that's important as well, and talking about what's the emotional support they need, how do you deal with anticipatory grief, how do you develop coping skills. So a lot of times in the moment where that patient, may be dying or they may be imminent, you see a lot of physiological changes, and there's a lot of dynamics that goes on with the family members and their loved one who's dying, and how do you bridge a medium to where there can be comfortability in that environment? How can there be that sense of safety and that sense of security and that idea of acceptance? We talk about Kubler-Ross and the different stages of grief and dying, and so every family member goes through them differently kind of in that moment, and it can be a lot for them to deal with, what's going on with, the body and how they transition. But a song that I use a lot is Bridge Over Troubled Water. I'm going to just play a little bit of it. When you're weary, feeling small, when tears are in your eyes, I will dry them all. I'm on your side when times get rough and friends just can't be found, like a bridge over troubled waters. I will lay me down like a bridge over troubled waters. I will lay me down. So, that kind of idea of a bridge, can be used as a metaphor for, what bridge is their loved one going on? Where are they traveling to? What are the waters the family are dealing with? So you can kind of process that with them in the moment. Of course, once their loved one may have transitioned and they passed away, you got to give them that time in the moment, the dynamics to deal with emotionally. Okay, here's my loved one, they died, and the grief. Everyone has different reactions to grief, physically and emotionally in the moment. And so that just can be really rewarding to try to help the family channel in the moment and try to use your counseling skills as to, why they have certain grief, or talk about memories or experiences with their loved one in that moment, about a trip or a wedding, or, just a certain memory that just kind of pops out in their mind that can just kind of ease, their suffering and help them give that acceptance. So it's so rewarding to be in that moment and with, the families in that moment. And I guess, being in hospice has really allowed me to reflect upon how far music therapy has developed over the years, and just how invaluable the work that we do with all these different populations and the effect music has. I'm working on so many different goals with so many different patients, and there's so much research that is out there as to how music, works with different populations, or different music therapy techniques, or, music and how it affects patients who are, hypothetically, let's just give a situation of maybe Medicaid, who are on particular medications, just different topics. And I just think that there's just such a strong direction music therapy is going in working on figuring out how we can figure out ways to be non-invasive with patients. How can we create a medium for expression and improving well-being and enjoyment, and using interventions like life review and reminiscing, or song discussions, or guided imagery, which I didn't talk about today, or enhancement of emotional expression through music. Music is a universal language, and I think more healthcare facilities are finally realizing that and are seeing the benefits of music therapy and working with different populations, and they want to integrate it into their programs, whether it's a long-term setting or a hospital or assisted living. I just think the end goal of music therapy is sky high. It's now becoming licensed, in certain states. So I think, today I hope I can bring more advocacy, more awareness, more education to people as to why music therapy is good, how it's beneficial, and where it can be used. I think planting that seed is just so important, and people are recognizing these seeds finally of what music therapy is. So
absolutely. Max, I want to thank you. I know we've run out of time at this moment in time, but you know what? I love music therapy. I think over my career, I've seen, it ebb and flow, and I think I've seen it change for the better, and that more people are accepting of it. And I do think that there's so much benefits to residents, patients, children, young, old, anybody, in regards to music therapy. So I want to thank you so much for being on the show, and I want to thank everyone for joining us. You can definitely check out our website, www.conversations-in-care.com, and I'll have that video of Max up in a few hours. Thank you so much, Max, for joining us, and for everyone else. Be well.